When arteries become narrowed or blocked, it can reduce blood flow to the heart, leading to serious complications. Fortunately, angioplasty and stent placement offer an effective solution, allowing a doctor to open a narrowed or blocked artery in the heart without the need for open heart surgery. The procedure begins with a cardiac catheterization, where a thin, flexible guide wire is first inserted through an artery, usually in the groin or wrist, to create a path for the catheter. The catheter, which contains a balloon at its tip, is then threaded along the guide wire and carefully guided through the blood vessels toward the heart using X-ray imaging. This allows doctors to access the blocked or narrowed artery directly. Once the catheter reaches the heart, the next step is to open the blocked artery. Now we're inside a heart artery. Here's the plaque that's blocking the flow of blood, and here comes the catheter. It has a balloon at its tip. Wrapped around the balloon is a tiny wire mesh cylinder called a stent. Stents help keep the artery open long-term, reducing the chance of it becoming blocked again. Most modern stents are drug-eluting, coated with medication to prevent re-narrowing by reducing scar tissue formation. Once the balloon is in place, the doctor inflates it. As the balloon expands, the stent around it expands too. Together, the balloon and stent press the plaque against the walls of the artery, making more room for blood to flow. Then the balloon is deflated, but notice the stent remains expanded. It's still holding the artery open. The catheter and balloon are pulled out of the artery and out of the body, but the stent remains in place inside the artery, keeping it open. Angioplasty and stent placement are common life-saving procedures that help restore blood flow and reduce the risk of future heart problems. With advances in technology, these treatments are safer and more effective than ever, offering immediate relief and long-term benefits for heart health. In some cases, doctors may perform angioplasty without placing a stent. This involves using only the balloon to widen the artery and restore blood flow. However, angioplasty alone is less commonly used today because arteries are more likely to re-narrow over time without the support of a stent. Note, all medical procedures carry some level of risk. While this procedure is generally safe and effective, it's important to be aware of potential risks involved. Thanks for watching. If you found this helpful, don't forget to like this video and subscribe to our channel. Better understanding leads to better health.